Hi, my name is Aspen, and I'm here to talk about my patient education assignment. I interviewed my 66-year-old mother-in-law. She lives down the street and was a perfect candidate to interview. I asked a series of questions regarding her largest medical concern and her health goals. I then asked a series of questions in relation to the medications that she currently uses and if she has any concerns with them. She does not have any concerns with any of the medications that she's currently taking. I then asked a series of questions that helped me determine her level of cognitive ability, and she showed no signs of cognitive impairment. I talked to her to determine if she had any concerns with moving or her mobility and confirmed she has no issues or concerns in that area. They also have quite a large dog that helps keep them active, so I think that's kind of helping. Her biggest concern, however, when it comes to her health actually is her nutrition. She recently had to get braces inserted, and this was due to clenching her jaw too tightly at night that it messed with the alignment. With her having braces, this has impacted the types of food that she's able to consume, and ultimately now is impacting her diet, her nutrition, and her fluids, and of course electrolytes as well. She's prone to getting flus and colds and is worried that without the proper nutrition, it's just going to take a longer time for her body to bounce back. So what we did is we searched some resources online to help determine what kind of nutrient-rich foods she can still consume that don't hurt her teeth or affect with her braces. She's pretty adept with technology, so we used her computer to do this. We first started looking at orthodontist websites for verified information, as well as the FDA website, as that actually had helpful resources for consumers regarding which foods to avoid when someone has braces, and it was very user-friendly. We did discuss the need for her to report this to her physician, as well as her orthodontist, in case she has concerns with the braces themselves as well. All the resources and websites discuss the need to avoid sticky candies, foods, or those that are hard to clean, such as popcorn and nuts. This was a slight hurdle as my mother-in-law is on a special diet and often enjoys low-calorie, unsweetened popcorn. But we discovered she can instead have some low-fat smoothies instead to help make sure she's getting all her nutrients. Moving forward, I will definitely ensure to implement the 4Ms in my practice, as it definitely helps the patient feel more involved with their care, and it helps me come off as a partner to help them problem solve any concerns that they have, because ultimately I am their partner in this. I can implement this into my practice by utilizing this framework anytime I'm building a report, meeting a new patient. It's also very helpful to use these tools once I'm evaluating their progress to the goals that we have set from this framework. It will also help me initially understand what their health goals are before implementing care. I can also use this framework when it is time to discharge a patient and ensure they have the proper resources and education needed to maintain their good health. Overall, I think the 4M model framework provided an easy way to discuss these items with patients and also an efficient way. So I do recommend them. Thank you.